Hey guys, so we have a question that we get asked a lot, and that is, what is your take on an inversion table? So that's the teeter table or any inversion table that you sit in or lay in, and then it goes upside down. So here's our theory on it. We like the idea of decompression. We do a lot of traction-based decompressive type of adjustments in our office. But there's a few things that kind of scare us. Number one, most of you don't know how to use it properly. Number two, you stay in it way too long. Number three, all the blood is flowing to your head rather than your lower back, where blood helps with healing and everything that you need to get your body moving in the right direction. So instead of hanging upside down, I want to show you a quick little tip using one of these bands. So usually these bands are used for pull-ups. They are actually assistants for pull-ups or any kind of workout for that matter, but they're usually used for pull-ups. You can find these anywhere, any sort of sporting goods store, on Amazon, on Google, just find them. Pull-up assistance bands, okay? So what we're going to do is utilize this to do a decompression of your lower back. This is something a lot of you have been asking for, so here it is. All right, so Dr. Megan has this band, and all she's going to do is find a door and a doorknob, and she's going to put the band on the inside, wrap it around that doorknob. And then when you close it, and make sure that people know what you're doing so they don't open it and like kill you somehow. And so when she closes that, you can see it makes this nice big loop. So what she's actually going to do is get inside of that loop, and she's going to put the band right at her lower back. And then from there, she's going to make her way on down to the floor. So now that she's on the floor, she can lay all the way down, and then she's going to extend her legs. When she does that, this band is going to create a traction on her lower back. And so you can see that it's right up underneath that lower back. This is nice and taut for her, and it's just going to get right above her glutes and pull this way. So again, it is that nice decompression on the lower back. It's very similar to what an inversion table will do, but you can see it's just a lot safer. You're not gonna get stuck in it. You're not gonna overdo it. You can hang out here for maybe a minute in the beginning. You can move up to 2 minutes. You could probably hang out here for a while. Or another thing you could do is a minute here and then bend your knees and do a minute coming back in with the knees bent, and then extend out. And so that's called imbibition. And what that does is it opens and closes that joint. It's almost like it's milking the joint, which brings hydration and blood flow to that area, which really helps to speed up any recovery. This kind of decompression feels really, really good. Try it at home. You will love us and thank us later.